and I'm a proud member of Columbus City Council and a proud ally and advocate for breast cancer awareness. I'd like to thank my colleagues, Councilmember Bankston, Councilmember Barosa de Padilla, Councilmember Brown, and our esteemed clerk, Angie Blevins, for being here this evening. It is a great night to kick off Breast Cancer Awareness Month. I want to welcome and thank each of you for stopping by tonight to light City Hall pink as we acknowledge this October 2023 Breast Cancer Awareness Month in the city of Columbus. I'd also like to recognize and salute the American Cancer Society for their advocacy and efforts to raise awareness and funds regarding breast cancer in Columbus and Central Ohio, and for being part of tonight's ceremony. Education and awareness of the facts and statistics surrounding breast cancer within our community is key in empowering individuals to make informed decisions about their health. But let's start with the facts. What is breast cancer? Breast cancer is a disease in which malignant cells form in the tissues of the breast. There are many different types of breast cancer that can affect both women and men. In 2023, an estimated 297,790 women and 2,800 men will be diagnosed with invasive breast cancer. Chances are you know at least one person who has been personally affected by breast cancer. And personally, this hits home for me. Over 20 years ago, my wife's best friend was having a conversation. She's a genetic counselor and understood that my father-in-law had some cancer history in their family. She said he needs to go get BRCA tested. He needs genetic counseling or genetic testing to understand whether or not he has some sort, if he's positive or not. Of course, he was. And both my wife and my sister-in-law had a 50-50 chance of being BRCA1 positive as well, and unfortunately both of them were. But that was also a bright source of knowledge and preventative care that took place. And so my wife is a previvor. I'd like to ask my wife and Laura to stand up. Liz Brown-Remy and Laura Brown, please stand up. Laura last year was diagnosed with breast cancer, and she's today is a survivor. My wife had preventative surgery in 2018, both of you. It's a special time to celebrate her conquering of cancer, and we appreciate their being here this evening. Breast cancer is more than a curable disease than it was 30 years ago due to increased awareness, tests just like we talked about, improved treatment options, as well as improved mammography screening, which helps detect breast cancer early. Thanks to enhanced screening preventative methods, as we all know, individualized and targeted therapies like those discovered at the James Cancer Center and Solove Research Institute, there are currently over 3.8 million breast cancer survivors in the United States. My heart is with all those that my heart is with and will continue to be with every thriver, survivor, and other family, friends, and caretakers who have been impacted by breast cancer. Please know that your fight is acknowledged and is carried with each of us on council. This evening, we are pleased to have an amazing lineup of speakers and advocates to share their remarks, as well as a special performance towards the end of the program before we wrap up and count down to the lighting of City Hall pink. First up, I'd like to welcome Columbus City Council Clerk Angie Blevins for a moment of remembrance.
Good evening, and thank you to Councilmember Remy for hosting tonight's lighting ceremony. Tonight it's important, I wanted to say, for those currently battling the disease, to see those of us here that are survivors and know that there's hope. I encourage you to be strong and don't give up and know that you're not alone. We would like to have a moment of silence, though, at this time to remember all of the brave warriors and fighters who lost their battle with breast cancer. We also remember those of us who survive and those of us in the future who will fight this battle. Those who are caregivers, the family, the friends, we lift you up in thought and prayer tonight. You are deserving of this honor. Please join me in a moment of silence and remembrance to all those that we lost too soon. Thank you so much.
Thank you, Clerk. I would now like to welcome remarks from Allison Katter-Heinrich, the Associate Director of Development for the American Cancer Society.
Good evening, everyone. You may have seen on your program that you were supposed to be hearing from our colleague Hannah tonight. The reason she's actually not here and I'm stepping in is, unfortunately, at ACS, we lost a member of our family and one of our colleagues to breast cancer on Friday night. Our strategic director of our distinguished events, Lee Kite, has been with the American Cancer Society for 18 years and unfortunately has been battling breast cancer for the last 3 and lost her fight on Friday. And so Hannah and some of our other colleagues are there to support her family for their services. And so, you know, this really hits home from a timing perspective and just that moment of remembrance too. I think we've all been affected in some way, and so just appreciate all of you being here tonight. And for Councilmember Remy and his team, we're so grateful for your support in bringing awareness to our mission. We're so excited to light City Hall pink tonight. The American Cancer Society really has a mission of ending cancer as we know it for everyone. We are a leader in the research space, currently funding over $78.1 million in breast cancer research nationwide, along with 2 grants at the James Comprehensive Cancer Center here in Central Ohio for $1.58 million, solely focused on breast cancer. And from the advocacy side, the American Cancer Society's Cancer Action Network advocates for funding of the National Breast and Cervical Cancer Early Detection Program, which has served more than 6 million people, encouraging screenings and early detection, which we know is really how we're going to fight and treat this disease. Lastly, through our Reach to Recovery program, more than 1.5 million breast cancer patients have received one-on-one support from fellow breast cancer survivors to connect and know they are not alone in their fight. This is really just the tip of the iceberg for how the American Cancer Society is improving the lives of people with breast cancer and their families. Thanks to supporters like you, we are on our way to fulfilling our mission to improve the lives of people with cancer and their families through advocacy, research, and patient support, and really to ensure that everyone has an opportunity to prevent, detect, treat, and survive cancer. Thank you for thanking Pink tonight, for coming to our reception earlier this evening, for being here now, and we hope you'll join us again just across the river at Genoa Park on October 29th as we make strides against breast cancer. Thank you.
Thank you so much, Allison. I'd now like to welcome remarks from my friend and colleague, Councilmember Barosa de Padilla.
Thank you, and good evening, everyone. I bring you greetings from the Columbus City Council and the Columbus City Council Women's Caucus. We are a small but mighty caucus. And it's interesting, as I thought about and reflected on my remarks this evening, I thought about the unfortunate and inconvenient truth is that every single one of us, if we talked about cancer, could raise our hands as to someone we've known or loved, or someone in our community, or someone we worked with, or a neighbor or a friend has had cancer. And it is unreal that we've gone too long in this society, that we've just accepted that as a fact of life. I chair public service and transportation. And it's interesting because the first time I got into my very first car accident, I was 17 years old. And I remember someone saying to me, like, hey, kid, this is just a part of life. And I feel like that's almost how we've thought of cancer, that this is a part of life, that this is much like I am an asthma. I've had childhood asthma, and just the same way we think of asthma, we think of cancer as this is something that someone needs to live with, and that is something that all of us need to stand up and say, within our lifetimes, we know that we can find a cure. And that people and families and our communities don't have to live with the reality of what cancer is and what cancer does to our loved ones. And I, like many of you in this room, have lost people, or in this space, have lost people that I love to cancer. It's either heart disease or it's either cancer. We know that people of color, especially women of color, disproportionately suffer from these diseases consistently. And as a younger person, I lessened my chances of cancer through a breast reduction that I didn't even realize at the time could be a life-saving measure for me. And when I turned 40, I had heard many of the myths around what having a mammogram could feel like. And I'll be honest in saying that for a long time I put it off because I was scared that would hurt, until a friend of mine was diagnosed with stage 4 colon cancer. And I realized at the time how silly I was, that 20 minutes or 15 minutes of discomfort could be the difference between 20 to 30 years of a lifetime with my friends and family of raising my children. And that was the difference between being scared of a mammogram and what it could happen, or just going to have it done. And so I urge folks today, and I know that many of the folks here today are survivors, so I'm not necessarily speaking to you, but as we air this on CTV today, for folks to get the screenings that you desperately need. No matter how uncomfortable, I'm now at that age where I started to get a colon screening. I'm now at the age where, your body operates a little differently. And now there are things that I didn't need to think about as a younger person, but I need to think about as a person who wants to live. And as a person who wants to see my grandbabies, and as a person who wants to live a full, long life. And so I urge folks today that ensure that you are keeping up with the screenings, ensure that as we hit those milestone ages, that you are going to see the doctor, because those moments of discomfort could be the life-changing moment for you and the people that you love. And so for the survivors and for your families who are on this journey with you, because this is a family and community proposition, I salute you and I thank you. And I thank you for your bravery, and I thank you for being in the struggle. For the folks who support all of the people who are in this community, I thank you for showing love and strength and support when other people don't always have it, and for being there with them. And so lastly, I will say that as we continue to have these conversations, that this City Council stands in solidarity with this community, because I do believe in my heart that in my lifetime, we can eradicate cancer if we do this together. And that this does not have to be a moment that this is something that affects your family before you care about it, but this should be something that we all care about, and that we all give our time, our talent, and our treasure to ensuring that there is a cure for cancer, and that every single one of us gets to live that long, fulfilling life. Thank you so much.
Thank you, Council Member. Appreciate you. Next, we have remarks by Dr. Bridget Opong from The Ohio State University.
I don't know if I can add to anything I've heard. Everything has been so inspirational, so on point. And it's blinding up here, by the way. First off, I'd like to thank the mayor's office, the officials that we've heard from today. your introduction was amazing, gave a lot of medical facts, some stuff that I would have said, but he stole my thunder. So now I got to think of something real quick. But you know, I'm not good at writing things down because I like to be in the moment. And the reality is that I had 4 surgeries today, 4 breast cancer surgeries today, and a whole range of women, different ages, different ethnicities. And this year, so I've been in practice 13 years, but this year it just felt different because we're busier. Our nurse manager, Ms. Dillard, is right back there with me tonight. And we've just said that, you know, where patients are scheduling 3 weeks. So for some reason, there's just a lot of new diagnoses. We know the statistics from the American Cancer Society that there will be almost 300,000 new diagnoses this year. And unfortunately, 40,000 women or so may succumb to breast cancer. But with that is different when I'm seeing it the way I am. I'm seeing younger women, you know, I'm seeing a lot of minority women, African American women, who historically had a lower incidence, meaning that we were less likely to get breast cancer. But now it's changed. Now we're getting it just the same as everybody else. So something has changed, whether it's environmental, whether it's age, whether it's genetic. It's probably a combination of all those things. But what that means is that we have a lot of work to do. And I love that there are so many of you here. I've been in Columbus for 4 years. I didn't even know this event existed. So I'm super excited to be included, thanks to the American Cancer Society. And a couple of things that I want to say. As a breast surgeon, this month means a lot to me. We do a lot of work. We're going to a lot of events. I had one yesterday. And again, I don't know if it's because of the pandemic that it's just huge turnouts. I went to one yesterday and I'm thinking, man, this is Sunday. I'm going to go. I had on my pink, but I'm like, ain't no one going to show up. People aren't going to come, but it was packed. And it was a beautiful event. It was inspiring. It was actually fun. I took my daughter, who's almost 5. She was dancing with a lot of the women, a lot of the survivors. So something is different in this moment, and I think we need to capture that energy and move things forward. All right. So to me, Breast Cancer Awareness Month is about that encouragement. You know, I want our survivors to know that we're with you, we support you, we pray for you, we pray with you. I pray with my patients who want me to, who are okay with that. And we also encourage the families, the supporters, because you may not be the one with the cancer, but you're going through the experience as well. So definitely the caregivers also need recognition. The other thing about Breast Cancer Awareness Month is that it's a time of remembrance. Like I said, every 3 minutes you're sitting here, somebody's going to be diagnosed with breast cancer, right? That's how we get that 300,000. So these numbers are mind-blowing when you put it all together. And for us in the health field, we see it. We see it every day. I have clinic on Wednesdays, and there are days when I see 9 new cancers in a day. And that's the most that I've seen in my career. You know, I won't tell you how old I am, but I've been doing this now for about 13 years independently, and it's just I'm getting busier and busier and busier, So there's something changing. And the other thing is that we need to remember those who we've lost, of course, and use their experience to live better. The councilwoman talked about that. Use that experience to make sure you get your screening, and not just breast cancer, but colorectal cancer, all the other types of cancer screenings that are available. And lastly, it's important to advocate. So advocate for yourself. If your primary care doc hasn't recommended a mammogram and you're due for one, let them know you need one. Don't be bashful. I'm from New York, so we're not that nice when it comes to that. We'll let you have it. The patients will tell you, hey, doc, what's up with my mammogram? I think patients in Ohio are much nicer, which is good for me. But I like to encourage the community to speak up for yourself, advocate for yourself. Part of that advocacy is to support our research. So I work for the James, and we collaborate with the American Cancer Society. And that collaboration is not just research. I know you hear a lot about things like immunotherapies, about new treatments, but also support for women. Like some women don't have transportation, for example. So we need your advocacy to get those funds to do the work that we do. And it's a huge lift. It takes the whole community. It takes the individual. And that's what we do. We collaborate to try to make these things happen, because it's not about, hey, I work for this person. I will work with doctors from Ohio Health. I will work with Mike. It's not a competition. I want patients to do well, So I thank you for coming out tonight. I thank you for advocating, because it's late and it's hot. Y'all can see I'm probably I'm sure y'all want to go home. I want to go home. I'm wearing these heels. I've been in the OR all day, and I'm here, and you're here. So this is important to us. It's important to me. It's obviously important to you, too, for coming here. And your efforts are not in vain. We see that, and we feel that. And as a breast surgeon, we need that encouragement, too, because it's hard. I see young patients. My youngest one last week was 29. And she had a really large tumor because she's not getting screened. So she had to feel something. And I know statistically she's going to have a long road. She's going to have a hard fight. Statistically, the outcomes are not favorable. And that's just, I can't even think about it. When I was 29, by the way, I'm still 29. I can't imagine living with this diagnosis, the weight of that, and what that means as you get up every day and work or live your life knowing that you have this sentence. But that's what we're there for. That's what we're there to support. And I encourage all of you to keep doing that. Keep providing support. Keep speaking up. Keep advocating. Keep supporting us. When you go to the stores and they ask you to round up, don't get annoyed. Sometimes I get annoyed too, I won't lie. But just give that extra dollar. Because that funding goes to help us do what we do, right? It helps us at the James. It helps the American Cancer Society. It helps the tremendous number of nonprofits that a lot of survivors themselves create to help women who have had cancer. So there's a lot of work to be done, and I want you to be a part of it. And whatever you can do, whether it's a one-on-one, you're supporting a relative, a friend, a family member, or you yourself want to start an organization, you want to advocate for a particular policy change, there's always some level of engagement that you all can have. All right, so I just want to leave you with that. And again, I thank everybody who's here tonight. Again, it's hot, and I'll keep it brief, I promise. Thank you so much.
Thank you so much, Doctor. We appreciate your comments this evening. I'd now like to share a warm welcome to our 3 breast cancer survivors speaking this evening. It takes great effort and bravery to speak on a topic so close to one's heart. On behalf of my colleagues and all of our attendees tonight, thank you for spending this time with us. First, we will hear from Monica Brooks, then Beth Gallum, and then ending with Peggy Loud. So if you'd like to come up and speak, we would appreciate hearing from you. So thank you so much.
Hi, everyone. My name is Monica Brooks. And, we've heard a lot of numbers tonight, and it hits home when I love the background music, first of all. It should be a party. Hearing so many of the numbers tonight, it really hits home knowing that I'm one of the 8. I was one that was diagnosed in 2018 at the age of 37 before I could even have a mammogram. I was not screening myself or doing any type of, I had zero body awareness, basically. But it's hard to be here. And I don't want to be here in the sense of I don't like the label of being a cancer survivor. I am thankful for today. I'm thankful to be here for you. But it's hard when we start talking about death, because that's what we're all scared of. And we're scared of the ones that we might leave behind, who may have to live without us. That's our reality, and we live it constantly. I didn't have this part of what I'm saying planned, but it just hits home, hearing people talk and the reality that we face. But 5 years ago, I was diagnosed with stage 3 breast cancer. So I'm in October, so this is my 5 year, and I'm so happy to be here with you tonight. I want to share with you just a few learnings that I've learned over the last 5 years that I think that may help you, whether you've had cancer or not. But before I do that, I want to share with you what brings me here with American Cancer Society tonight. Because when they connected with me, one of my first questions was, where does the money go? Like, that's what we all want to know when we give that dollar, when we round up at the register, where is it going? And I was thrilled to learn that over $78 million goes specifically to breast cancer research. 78 million. Yes. And over $1.5 million stays right here in Columbus at the James. So it is amazing to see that work, the money that goes to the research, because we are losing people. We are losing mothers and daughters and nieces and cousins and nanas and grandmas. And I'm tired of it. I'm so tired of it. So it's important to me to support the American Cancer Society, as well as being a Mexican-American female, knowing that there's so many health disparities that was mentioned earlier. We need more attention on that. And American Cancer Society has funded over 61 different grants specific to health disparities. They want to know why it's happening, what's causing it, and then what can we do about it. So it was just a pleasure to be here tonight and to be with so many people, with you and with American Cancer Society. So let me briefly tell you some of my learnings, and I think, and I hope that you at least take one, if I can just plant that seed with you, and hopefully you can water it and it will grow, and you can somehow grow through this whole experience of cancer. One of my first learnings when I was diagnosed was to take my power back from cancer. Cancer takes so much from you. It takes not just your hair, but your dignity, your vitality, your youth. I'm in menopause. I have osteoporosis at 42. It's crazy what it does to you. But there are certain things you can do to take your power back. And I learned that early on when I started helping other people. When I created a YouTube channel, just because I wanted to document my journey, because I knew somewhere at some time someone was going to need to know what it's like to go through chemo, radiation, a mastectomy. I also began a podcast, the Breast Cancer Podcast, with my breast surgeon. We're in over 90 countries now, which is pretty amazing. And that's just been amazing to be able to help people. So I encourage you to find ways to take your power back. Don't let cancer have that power over you. Physically, mentally, whichever way, find ways to take back your power. The next thing is the power of presence and staying here in this moment right now. Not the past, not what's happened to you, that's done. It doesn't exist necessarily in a time aspect. And the future. I don't fear cancer coming back. That's in the future. I can't control that. That's actually robbing me of my time right here, right now, in the moments that I have. So do whatever you can to stay in the present moment, because this is always where you're going to find the most joy, is right here and right now. Another learning is I learned that cancer is so lonely. It is the loneliest disease. I don't care how much support you have and how much family and friends that love you and shower you. It is lonely. So find your community. Find the people that know exactly what you're going through and what that feels like. Now, this next one, sometimes I think people hear me or mishear me. Find the gifts of cancer. I do not mean that cancer is a gift. I mean that when you're diagnosed, to keep your eyes open to the beauty and the things that happen from that. You will form friendships. You will find so many amazing people. There are people that as was mentioned, that start nonprofits. So much work can happen and so many beautiful things can happen if your eyes are kept open to see the gifts. Yes, cancer is ugly, but it is up to us to see the beauty in everything else. And lastly, one of the most important things I've learned is that each day is a gift. You do not take it for granted. You are here tonight, whether you feel good or not, whether it's been triggering or not. We have today, we have our breath. Oh, it is so amazing. And every time I start to feel like I'm taking it for granted, or sometimes when I get a little bit of stress, I think of, any Hamilton fans in here? Yes, I love Hamilton. So they say, look around, how lucky you are to be alive right now. Look at where you started, and look at where you're at, because right now is a miracle. And how lucky we truly are to be here tonight in our community, to be here to support each other, and to light this city up. Thank you.
Good evening. My name is Beth Gown. And a routine mammogram saved my life. In 2019, my sister was diagnosed after a routine mammogram. Growing up, she was diagnosed with Hodgkin's at the age of 14, so she was more at risk. So my mom pushed her to go get a mammogram. Unfortunately, she was diagnosed. After that, I immediately made an appointment with my gynecologist to discuss the recent findings, and also because both of my grandmas had been diagnosed with breast cancer in their late 70s. My doctor and I decided that the best path was to get an early screening since I was only 38. It was a good thing as I did because they did find a suspicious area. After a year of monitoring and a few biopsies, I was diagnosed in March 2020 with stage 1 invasive ductal carcinoma. When you hear that you have the big C, it's terrifying. The waiting can be unbearable. On top of all this, the world was undergoing one of the craziest times we've ever experienced with COVID. As challenging as cancer is for anyone, seeking treatment and support during a global pandemic made things just that much harder. Routine tasks like going to the store for food and supplies or picking up life-saving prescriptions added unnecessary risk to an already terrifying experience. Despite all the chaos, I'm extremely fortunate because I have the most loving and supportive group of family and friends that I could ever ask for. They were doing everything in their power in every way they could, mostly from a distance because of COVID. They dropped off meals at my door, sent me care packages, called me every moment to check on me. I was lucky enough to also have an incredible team of doctors and nurses that aided and guided me through the process. I can't thank everyone enough. Even though I'm still undergoing some treatments, I feel extremely grateful. I chose to get my mammogram as I had no outward signs. I was feeling healthy and no pain. I didn't find any suspicious lumps or bumps. I truly believe I stand here before you because I got my screening early. My mother, who's sitting in the audience today, was diagnosed with triple-negative breast cancer in March of this year. It's just another reminder to stay consistent with your annual mammograms, because it's so life-saving. I'm proud to stand here as a cancer survivor. I'm even prouder to share my story on behalf of the American Cancer Society, Making Strides Walk. I ask that you educate yourself, educate others, get a mammogram, push for someone else to get a mammogram, and participate in the walk and donate. We're fortunate we live in this country where we're able to do these things. Educate yourself and check in on your loved ones. You could save your life as well as someone else's. And if you take one thing away from the evening, remember to get your mammogram, as it saved my life, my grandma's, my mother's, my sister's. Do remember that early detection is the key to saving lives. So I really appreciate my family here and my boyfriend. They've been nothing but the best to me. I feel so fortunate. Like Monica said, you have to look at for the good when it comes out of the evil. So thank you for your time.
Oh, yes, it is blinding up here. Good evening. I bring you greetings from CODA's Women's Employee Resource Group, where CODA employees strive to bring awareness to women's health. I don't want to cry. I ditto what both of these ladies have said tonight. I'm not a free speaker, so forgive me. I'm going to read to you my story. Never in my life did I ever think I would meet this thing called cancer. After all, it wasn't something that I knew. No one in my family that I knew of had it, so why would I be concerned? So I thought. 2019, I was diagnosed with invasive ductal carcinoma, stage 1. It's still hard for me to believe I was diagnosed with cancer, even though it's been 4 years and 2 days since my surgery. Truthfully, I think I still haven't fully processed my diagnosis and experience. Everything went so fast. From the diagnosis, October 10 of 2019, to the lumpectomy on October 21st, 2019, to 8 weeks of radiation treatment after. I felt like I was having an out-of-body experience. It went so very fast. I didn't tell anyone right away. I think I was too afraid of their reaction and how I might react to their reaction. I decided to tell my family after my treatment. I still didn't tell them until a year later. I felt a lot of sadness after my treatment. I couldn't understand why I was sad. I realized very quickly that I was suffering from survivor's remorse. I really didn't want to remember anything about cancer. Even when I was going through it, I didn't want to know about it. I didn't want to think about it or anything like that. But when I took my shirt off, the discoloration was a constant reminder that I was living this life. Yet I didn't feel worthy of the title survivor. I didn't lose my hair, I didn't have chemo, I didn't feel any pain, and I certainly didn't think that I had a story to tell. But I stand before you this evening knowing every one of us has a story to tell, and it's just as important to be told. The Mount Carmel East Women's Health Center saved my life. Early detection saved my life. Their rapid response and care made all the difference in the world to me. My surgeon, Dr. Christian D. Slam, and the Taylor Station Surgical Center, her general approach to explaining everything to me made me calm down immediately, and I knew that I was in the right hands. I'm so very thankful to God that I didn't suffer, that I didn't lose my hair, that I didn't have chemo, and most importantly, for early detection. After all, I have gone for my yearly exams. Who knows where I would be? Who knows what would have happened? I will forever be grateful to now stand before you and say that I am a survivor. I continue to talk to my coworkers about getting their yearly exam, men and women, because men can have cancer too. It's so very important. October 21st of this year, prayerfully, I will be cancer-free. Thank you. 5 years later.
Thank you. That was incredibly impactful, and of course, these are just a few of the immense number that are out there of stories. And so we applaud you, we congratulate you, and we thank you for your journey in hearing about it this evening. Can we give another round of applause for these speakers this evening? Thank you so much. I want to take a moment to thank CODA for joining us tonight through our guest speaker, Peggy. CODA is lighting their headquarters on High Street pink in honor of Breast Cancer Awareness Month. Next, I'm excited to introduce Miss Larica Williams, who will give a special performance of Rise Up by Andra Day.
Hi, everybody. I just want to start by saying I am honored to be here and learning so much from all of you. You guys are all amazing. You guys look beautiful. Your stories were very inspirational and inspiring, and I just want to say thank you for even having the courage to get up here and even say anything about it, because I know like when you are going through something, it's kind of hard to even speak on it half the time. So I just want to say I appreciate every one of you that are here. I'm honored to be here to support the cause. My grandmother actually had breast cancer. She had it twice. The first time that she had it, I was so young, I really didn't know a lot about what was going on at the time. She had it once, she beat it, and when it came back, it was just more gruesome, and she lost that fight, unfortunately, when I was younger. But I'm just like here to honor her, honor all of you. The song that I'm singing is called "We Will Rise Up" by Andra Day, and it's just a very inspirational song, and hopefully I'm able to touch someone here and we can just all rise together. You're broken down and tired of living life on a merry-go-round, and you can't find that fire, but I see it in you, so we gon' walk it out. Move mountains, we gon' walk it out. Move mountains, and I'll rise up, I'll rise like the day, I'll rise up in spite of the ache, I'll rise up, and I'll do it 1,000 times for you, for you, for you. Bring it to its feet. Move mountains. And I'll rise up, I'll rise unafraid, I'll rise up in spite of the ache, I'll rise up, and I'll do it 1,000 times again. And I'll rise up, light of the age, I'll rise up, high like the waves, I'll rise up, and I'll do it 1,000 times again. For you, for you, all we need is hope, for that we have each other, for that we have each other. We will rise, we will rise, so we'll rise. We'll rise up. I like the waves we rise up. In spite of the ache, we rise up. And I'll do it 1,000 times again for you. For you, for you, for you. Bless all of you. And I thank God for allowing me to be here. And
Can we give another round of applause for Miss Larika Williams? What an amazing, I love that song, and to have that rendition of it, I appreciate you. So thank you. Thank you all for joining us this evening for this Breast Cancer Awareness Month lighting ceremony. Can we give everyone else a round of applause that we celebrated tonight? A big thank you to American Cancer Society for their leadership, advocacy, and fundraising in the name of breast cancer awareness. Your commitment to this fight is palpable, and I am thankful for your partnership on today's event. I'd like to thank my team, Lucy Frank and Kaylin Pittman. Thank you so much for the work that you did this evening, because I know we're small but mighty. We put these things together, and they're a lot of work, and so I appreciate that. I want to thank CTV for broadcasting this evening. It's great to get this word out and let people in the city of Columbus and the region know that what we're doing here tonight. And now I'd like to invite all of our speakers. I'd like to invite my council members up, the speakers, survivors to the front, my wife and sister-in-law, my kids, if they want to come up, as we count down to light up the City Hall pink.
Way up here with you?
Yeah, right up here. Yeah, of course. Come on. We're going to do a 10 count. Not a 3 count, 10 count. My son's probably on his phone, I'm imagining, if I had to guess. So, thank you all for attending. Let's start with 10. So we'll go with 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thank you all so much. We appreciate you. Appreciate your story.